We start tonight with something we've talked a lot about since 2020, children's mental health, particularly in rural areas. It's an issue that, according to doctors and researchers, is only getting worse. And a new report highlights how increasingly hard it is for families to get the care their kids need. There are logistical challenges like travel and wait times. On top of that, fewer professionals are even available, begging the question, what are parents supposed to do? Jennifer Hoff looked into it and joins us now. Jennifer?
Carla, that may be the best part of this new report, that despite all that bad news, the lead researcher tells me that there are 3 key opportunities to get help, and it is available immediately.
This was turning into a larger and larger report.
A roundtable presentation with some of the state's top experts working to get to the bottom of children's mental health.
Where do rural parents get help for their kids?
A question prompting the year-long project with results the lead researcher says can help families right away.
What is the state of rural health right now?
Rural health overall is, it's okay. It's like everybody else. But in rural areas, there are barriers to getting help that create more of a problem for rural families.
Marnie Werner has studied rural issues for 2 decades, most recently with the Center for Rural Policy and Development that started in the 90s to gather nonpartisan data on issues in greater Minnesota that now finds mental health issues are growing and rapidly.
How do you know when your child needs help?
When your child starts acting strangely or is quiet instead of, their normal self.
The data is especially telling in girls that shows 35% of them dealing with these issues in 2019, the number jumping another 10% in just the next 3 years.
You can really get that feeling, kids can get that feeling of, am I the only one that's dealing with this? And when you feel like you're the only one, it becomes a barrier to seeking out some help.
That's on top of long wait times, fewer clinics, and a doctor shortage, plus the persistent stigma around getting help. But Werner says that's where she discovered the good news.
It's a slow process to get things done. You're trying to turn the ship. And I was surprised at how readily available these things were, how quickly these things turned out to be solutions for rural families.
Her findings point to 3 things families can turn to today, including existing education. Knowledge can alleviate fears. Providing mental health services in schools. State grants are paying for therapists right now in nearly every county. And the integration of mental health into primary care. 89% of rural physicians already offer this.
Instead of going to the specialty clinic to see a mental health provider, there's a therapist right there in your regular clinic, and that gets the connection started right away.
Consider them shortcuts to breaking down barriers when time is of the essence.
So I was just really excited just to tell people about it.
Really just some small steps as we obviously continue to work on the larger project, a problem that is. And then there's this, another important resource, 988, launched about 2 years ago. It not only addresses suicide prevention, but all kinds of crises. And you can do it in a number of ways. Through the phone, you can text, there are chats, all with a network of hundreds of call centers that are all across the country, Carla. So there are options, but of course we all know it can be difficult to start those conversations.
Oh, those conversations are so difficult, of course, but yet this is hopeful. This is good news for families who have been struggling with this, especially during the pandemic. Those numbers you shared are startling, but very familiar to the families who are experiencing it.
Right. This was a report, I think, that showed both of those. Again, some bad news. We have to recognize that children are struggling, but hopefully folks can kind of drill down on a couple of those few options there that are available right in the short term.
Thank goodness for that. Thank you so much for that report, Jennifer. Really interesting.